The purpose of this presentation is to discuss how to prevent tuberculosis. Recently, I've had a few close friends who've been diagnosed with tuberculosis, and I've realized we don't have a lot of information, or maybe have the wrong information about tuberculosis. So the purpose of this presentation is to talk about how to prevent tuberculosis. Tuberculosis is a common disease in Kenya, and it is the number 4 cause of death in this country. The cases of tuberculosis have been increasing, which has been largely attributed to the prevalence of HIV and AIDS. Contrary to popular belief, the majority of people with tuberculosis do not have HIV. 40% of all patients with TB are living with HIV, and so HIV is a big risk factor to presence of tuberculosis. So what are the ways to prevent tuberculosis? The first one is through vaccination, and usually children are given a BCG vaccine, and most of us have a BCG scar. It usually provides children with protection against tuberculosis, but it does not provide protection in adults. The next way to prevent TB is by education, and it is necessary for people, especially those ones on TB drugs, to know how to take the drugs properly to make sure they do not pass tuberculosis to other people. It's also important for the public to be aware on basic information about TB, how it's acquired, in order to also reduce stigma against tuberculosis. Tuberculosis treatment has also been used as a method of prevention, and the World Health Organization recommends the use of the drug isoniazid taken daily for 6 months to prevent tuberculosis in those at risk of progression of latent TB to active TB. These people are infants and children less than 4 years, people infected within the last 2 years, people infected with both tuberculosis and HIV, and people with immunosuppressive conditions like HIV, diabetes, and cancer. In our households, there are a number of strategies that can be used to prevent transmission of tuberculosis. The first one is houses should be well ventilated, and cough etiquette and hygiene should be observed at all times. That is to cover your mouth and nose while coughing. In patients who are proven to be smear positive, they are advised to spend as much time outdoors, to sleep in a separate and adequately ventilated room, spend as little time as possible in public large gatherings. There has been development of multiple drug resistant and extra drug resistant TB with a number of cases in the country. Such patients are advised to use face mask, and for extra drug resistant patients, they are isolated. In healthcare facilities, there is risk of transmission to other patients and health workers, and hospitals are expected to come up with local infection control guidelines. If you'd like more help, kindly follow us on Facebook and Instagram. That's Medihub Kenya. We'll be having a Facebook Live and Instagram Live discussion on the same topic by the end of the week. Also check out our website, and also the National Leprosy and Tuberculosis Program website.